health. So I'm just going to set the scene a little bit and then introduce our main speakers about why we're here today. So across the Hampshire and Isle of Wight system, the Integrated Care Partnership has been exploring the importance of home within its emerging strategy as a founding determinant of health and wellbeing. By recognising that health begins at home, we're unlocking the capacity and the resources to move from a position of treating symptoms of people's lives to really supporting people in the place where they live their life, and keeping people safe and well at home is not only going to improve outcomes, but is also going to reduce demand across the system and create that system sustainability. But no one organisation can do this in isolation. These are some of the knotty issues we've got. So whether we work for the police, the fire, the probation, social care, primary care or secondary health care, or other statutory and voluntary services, the nub and the very essence of all our collective energies, in very simple terms, is to keep people safe and well at home, helping people to live independent, flourishing lives with good health and well-being. And there's so much more we can do in this space. So I want to start by inviting you to think about, what does home mean for you? So for many, home is a welcome chaos, the reassurance of a family hub, a place that is a sigh of relief as you walk in the door. It could be safety, relaxation. For some, it's silence and stillness, a place where you can shut out the world outside. But very sadly, that is not the same positive experience for everyone. So for some, home is a place of fear, apprehension, walking on eggshells, exploitation, hurt, anger, or spiralling trauma. And our experience of home and the conditions in which we're born, that we grow, we work, we live, and we age in, really shape our daily lives. And it becomes the anchor point for our reference around our existence and our base where everything begins. It's the founding determinant of our health and well-being. And if we lose our home, our homelessness affects absolutely everything. It's not simply houselessness, but it breaks our roots, our ties to a place, our sense of self-esteem, our sense of belonging, and it can result in spiraling loss. So when you lose that ability to cook, sleep and self-care, it really impacts your safety and security. And for some, that can happen again and again and again in a spiraling cycle. Quite simply, without a home, nothing can fall into place. Across Hampshire and Isle of Wight, individuals and families who live with the trauma of losing their home face sometimes repeated, significant and multiple disadvantage. And I'm going to share with you some of the data across Hampshire. So this was at March 2023. Homelessness and the broader problem of housing stability affected around 10,000 households across our footprint. So 1 in every 90 households we came into contact with experienced some form of housing insecurity or homelessness. The average age for homelessness is 37 years old, and the average age of death while homeless is 43 years for women and 45 years for men nationally. And when you think that that compares with a circa 85-year life expectancy for the rest of the population, that's 40 to 45 years less than the national average life expectancy. Over the last 10 years, 107 people died whilst homeless, mainly from treatable causes. So that could be things like tuberculosis, strokes, cardiovascular disease, gastric ulcers. And this could be because people are struggling to engage with our services. So how can we do more to reach out to support people? Some often experience significant life changes and trauma, comprising their ability to lead fulfilling lives or sustain healthy relationships within their homes or their work. And our support can sometimes focus on what's wrong with you, rather than what matters to you. Others fall into cycles of homelessness, mental ill health, inpatient stays and imprisonment. Their physical and mental health can be compromised by co-occurring drug and alcohol misuse. They can experience entrenched poverty, periods of rough sleeping, long periods of ill health, disability and hunger. People often face stigma or discrimination as people make assumptions about someone's life choices and forget to see the person. They just see someone who ticks too many boxes. And we can perhaps use service thresholds as a barrier to support. People might be too complex, too risky. Our data evidence suggests people are often discharged or released from services without care of their next step. So people are often released with no fixed abode, simply because they've arrived with services with no fixed address. So this only continues the cycle of crisis, treatment, recovery from crisis, and then we begin again. We've done some assessment of the costs. So there is the human cost, but in terms of financial costs, our estimates are that this costs the Hampshire and Isle of Wight system a minimum of £38 million per annum. We could use that very differently to achieve better outcomes. In short, homelessness can be devastating, dangerous, and isolating. It's multifactorial, with complexities that are further evident with people who are experiencing homelessness, sleep rough, and despite numerous offers, are unable to change that situation. Safe, secure, and stable housing when provided in isolation is not always the solution to a more sustained quality of life. We need to work as a whole system and garner a sense of collective ownership of homelessness prevention to reduce health inequalities, poor life outcomes, and the costs to all parties, and to safeguard people throughout our communities. How we hold someone's hope for a better life when they're unable to do it themselves relies on how we work together and how we problem solve together, more than just the individual relationships, but how we embed those different ways of working within the very fabric of our respective organisations. And for me, within Southern Health, this is absolutely imperative. Excuse me. If your home is temporary or insecure, or perhaps you live in a shared or overcrowded home, you might experience stress or anxiety. You might worry about the cost of housing, food, heating and lighting, or your well-being may be impacted because of the people you live with. You might feel anxious, unsafe or uncomfortable, living in a community with people you don't know well, perhaps that are noisy or live in a way that makes you feel awkward, impacting your sleep, your well-being and your relationships in the home and at the neighbourhood. Many people currently are impacted by high housing costs and live in a home that's too small for their family size, or they're unable to sustain rent or mortgage payments, and they're at risk of losing their home. Other people might have problems with recreational drugs or alcohol, which impacts their mental health. And this in turn can make it hard to sustain or to find housing, which could make their mental health problems even worse. So fundamentally, health begins at home. And without a home, nothing else can fall into place. As I said, it's not the gift of one single organisation to be able to find those solutions. We all have a part to play to keep people safe and well at home. So today we're sharing some examples of some fantastic partnership working, our insight and learning. And of course, we've not found all the solutions, but we are committed to keeping learning, keeping improving, sharing what does work and what doesn't. And decent, affordable homes are the foundations of our healthy lives. So housing is all of our business. So I'm now going to introduce our first speaker. So we've got John Pritchard from Southern Health, and John's going to talk about the impact of co-locating mental health experience within local authority housing advice services. Unfortunately, Megan was unable to join us today, so John is flying solo on this item, but I'm sure he is more than capable of doing it. I think we're going to take questions at the end of our three speakers, so please do jot down your questions as you're listening to these talks, and then we'll take a question and answer session at the end. So John, over to you.
Brilliant, thank you. Thanks, Heather. Thanks, Sharon. So yeah, good afternoon, as we are now. Good afternoon, everybody. So my name is John Pritchard. I'm Associate Director of Housing and Community Inclusion at Southern Health NHS Foundation Trust. So for those that might not be familiar, Southern Health provides mental health, learning disability and community health services across the county boundary of Hampshire and the city of Southampton. So as you've heard, Megan from the New Forest was due to be joining me for this section of the event today, but she's had to give her apologies. So I'll do my best to cover off all of the content and apologise in advance for the amount you'll hear from me today. I'll do my best to keep it varied. Thanks, Sharon. Next slide, please. So firstly, I thought it might be helpful to give you a bit of context regarding my role as I am in a fairly unique position within the NHS. I was the first and one of only two director level colleagues focused on housing working in the NHS. And there are three main streams to my role, really. So one is looking at the discharge destinations for our service users. So where are we discharging people to? How are we discharging them? Along with the links to the housing teams in our local districts and boroughs. Secondly, we're doing lots of work around our approach and strategy towards key worker accommodation, both from attraction and retention perspectives. Our vacancy and colleague turnover rates are both higher than we'd like. So we're seeing housing or housing related support as levers we can use to positively influence these challenged areas. And thirdly, changing how we work with our partners in the community to keep people safe and well at home, enabling people to live their best lives in their own homes as much as possible. This work enables colleagues to move away from a purely medical model of health and well-being to a social model which embeds health, driving more sustainable discharges. And alongside me, we have some brave and bold system colleagues who absolutely understand the importance of using home as a lens to well-being, which really supports my work. The strategy adopted by the Hampshire and Isle of Wight Integrated Care Partnership reflects this work, targeting health inequalities at its core. So throughout this session, we'll share some examples of how Southern Health are working with local authority partners and other statutory and VCSE organisations to ensure that people are either able to stay in their own homes for longer or can move through the system more swiftly. Thanks, Sharon. Next slide, please. So let's look first at an example of how we used the experience of the Everyone In campaign implemented at the start of COVID to strengthen links and collaborate with local authorities. This joint work has enabled us to continue to safeguard people who are homeless or those who are at risk of homelessness. We've created new partnerships between local authorities and Southern Health, embedding mental health clinicians into local authority housing teams. So at the current time, we've got 5 posts live, which cover 6 of our local authority areas. So typically, they provide mental health crisis support, deal with concerns raised by their housing colleagues who may have noticed deteriorating presentations, take part in street homeless outreach work to support people sleeping rough, to engage with secondary care services. But they can also undertake health and wellbeing checks while seeing these folks. And furthermore, they sit as part of the housing needs assessments to ensure that the individual's mental health needs are taken into account as part of that traditionally single-sided process. So at the most basic level, these roles are preventing hospital admissions, avoiding evictions, keeping people safe and well in the community, employing a multi-agency safeguarding response, and ensuring that accommodation offers from local authorities are appropriate for individuals' needs. The impact of the joint working runs much deeper than that, of course. Next slide, please, Sharon. So these roles first came about because New Forest District Council, who are one of our very good local authorities, who have a really strong support offer to their tenants, was struggling to get a timely response from mental health teams when they noticed somebody was starting to deteriorate or decompensate. This was particularly prevalent as some of the most traditionally underserved people were offered accommodation during COVID. So the mental health teams would often cite workload pressures as the reason for not being able to respond. Instead, they would schedule an appointment to see the person in several days or a week's time. This was often too long, resulting in people needing a hospital admission as they had continued to deteriorate rapidly. And when we looked at why the team were unable to respond quickly enough, it was, in a large part, due to the amount of unscheduled workload that was coming through to them. They were being pulled all around their geographical patch, responding to these crisis calls. So not only was this resulting in a poor service to those people who most needed their immediate support, it was interrupting the support they should have been providing to their scheduled caseload. And interestingly, by adopting this partnership approach, we haven't added any additional resource to the area. We've simply used our precious nursing resources in a more efficient way. Picking up these crisis calls at source and being able to respond to them in a more timely manner means we catch somebody earlier in their cycle of illness and can prioritise the right support their way. From the local authority's perspective, it frees up housing officer time as they know their health needs are being addressed. The local authority report less damage to their properties, lower rates of antisocial behaviour or neighbour nuisance where this holistic support is in place. The housing team are also becoming naturally more educated in mental health, learning how to approach difficult conversations or work with specific needs to get the greatest level of engagement and secure positive outcomes. The clinician can also facilitate instant debriefs and reflective practice, recognising that sometimes housing services deal with traumatic events or incidents. Thanks, Sharon. Next slide, please. So let's look at the impact of this approach. There we go. This data set is from New Forest District Council, where we have a mental health nurse embedded within the housing team. This colleague had been in post delivering this support for about 18 months when this data was collated. During that time, they supported 62 individuals. The colleague successfully worked with 9 people who were sleeping rough to come in off the streets. There's an outcome that the local authority hadn't been able to achieve alone by approaching the situation solely from a housing perspective. They've also prevented at least a further 9 people needing a hospital admission who were already in community-based accommodation, and that was usually a temporary, emergency or interim solution. The 2 supported hospital admissions referred to were facilitated admissions. So these were planned in response to an individual's deteriorating mental health presentation. These planned admissions are often a lot shorter than emergency admissions or involuntary detentions under the Mental Health Act. There have been 16 referrals made to our social care authority. These are for people who are in the community with unmet need. All 16 are now either in receipt of social care support or in the process of being assessed when the data was collated. If that support isn't in place, then there's a significant risk to the sustainability of somebody's chances of maintaining a home or moving on from a temporary setting. 2 people were identified as needing a more supported setting than the temporary provision could provide. These individuals were referred to and accepted by specialist supported accommodation providers, meaning they're now receiving the care and support they require, appropriate to their needs. And the final one I'll pull out is the number of accommodation breakdowns that have been avoided. 10. So that's 10 people who haven't been evicted from their home due to mental health deterioration or ill health. Instead, they were supported to access the help or treatment they needed, and as a result were able to maintain their tenancy. Thanks, Sharon. Next slide, please. So this case study really shows the impact of our joint working. It was put together by colleagues at New Forest District Council and shares the experience of one individual whose life has truly changed for the better. That's a chap that we'll call Martin. So Martin approached the homelessness team in December 2021 as his landlord could no longer cope with his mental health needs. At this time, he was a patient in hospital after trying to end his life. He'd suffered sexual abuse as a child, and due to this had complex trauma and consumed large amounts of alcohol daily. In February 2022, he was admitted to hospital again after being found on a bridge and heavily under the influence of alcohol. He was placed into emergency accommodation. The next few months were challenging. Martin would struggle with his mental health, consume a large amount of alcohol, and then openly self-harm. He would then be admitted to hospital, and due to the incident, the proprietor of the accommodation would no longer feel comfortable to continue to accommodate him. In the space of 5 weeks, this happened 5 times. A professionals meeting was held late in March 2022, after all accommodation options had been explored. Now, sadly, Martin could not access a dry or wet house in the New Forest area and didn't meet the local connection criteria required by services in Southampton or Bournemouth. A few days later, Martin was evicted from his last accommodation option and ended up again in hospital. Now, at that point, New Forest made the decision they could no longer continue to accommodate him. Between April and May 2022, there were further incidents of alcohol and self-harming behaviours in the community. So New Forest decided to try again, and this time with the support of the mental health nurse, Natalie, and a personalised plan of action to support Martin. From June through to October 2022, Natalie provided mental health support, validation, assisted Martin to access AA meetings, assisted him to access sexual abuse support, and intensively joint work with drug and alcohol services. And no further crises occurred during that time. And as of January 2023, Martin has moved into longer-term social housing. And Martin said himself that the intervention from the mental health nurse saved his life. Really powerful story. Thanks, Sharon. Thank you. So this solution, along with the others you'll hear throughout today's event, are powered by the principles of partnership. To try something new and different, to look at our system-wide thorny issues through a different lens, and to recognise that no single organisation can resolve them. We need to bring our constituent strengths together to have maximum impact. Consequently, we're expanding the solutions you're hearing about today across our estate, expanding those partnerships further and faster. So based on what we've learned at Southern Health, I thought it might be useful to provide some pointers about the types of questions that are worth asking yourself and partners if you wanted to establish closer working relationships. The answers will highlight the gaps in provision or areas where you perhaps lack knowledge, and that's okay. Understanding and acknowledging this is the first step in closing those gaps. Keep these questions in mind as we go through the remainder of the presentations today to consider where you see yourself in your system. These slides are going to be made available after the session, so you can also reflect back on these questions at a later date. The most important point perhaps is at the bottom: connection. Build those relationships with partners. Find out who's delivering what in your local place or across your system. Who's facing similar challenges to you? Could you bring your constituent strengths together and tackle them collaboratively? How powerful would your collective voice be? Thanks, Heather. Back to you for now.
Thanks, John. Don't get too comfortable because we're coming straight to you.
Yeah.
But I mean, incredibly powerful presentation. Thank you. Really strikes me, one of two roles across the nationally that's unique around that housing role. So what more could we achieve if we all stepped a little bit outside our own organisational traditional boundaries to work more collaboratively? And really powerful to hear around how that earlier intervention not only achieved much better outcomes for individuals, but actually created all sorts of efficiencies across partner organisations. So really powerful. So, John, we are going to hear from you again about your other project around the Citizens Advice Services. So thank you.
Brilliant. Back to me, I'm afraid, folks. Okay. Thanks, Sharon. We can go to the next slide. Excellent. Thank you. Yeah, we can go on to the next one, in fact. There we go. Thanks. So we've implemented some other fantastic solutions at Southern Health to reduce the social stresses in our service users' lives, which impact on their ability to engage with housing or return home in a sustainable way. Usually there's something going on in somebody's existence which leads to them coming into hospital. Then that might be debt, issues at work or with family, relationship breakdown, problems with landlords or legal disputes. And colleagues in our hospitals are not equipped to deal with that. Traditionally, their only real option is to signpost somebody to the likes of Citizens Advice post-discharge. And the evidence tells us people don't go. Perhaps they lack confidence or don't know what to ask for, don't like the formality of the setting, have legitimate concerns about being stigmatised against, or perhaps are embarrassed or just don't want to tell their story again. Ultimately, whatever the reason, they go home and hope that the problem will go away. Of course, it doesn't. It gets bigger, more out of control, until their mental health is impacted and they end up back in hospital. So we've been piloting a new service with Citizens Advice in one of our hospitals. A Citizens Advice caseworker works directly with our service users for just 3 days a week, and the outcomes are truly phenomenal. So in the first 12 months of the pilot, Citizens Advice worked with 64 people, who each had an average of 6 distinct advice needs. Now, the average amongst high street Citizens Advice services is between 2 and 3. So we can see straight away the significant level of advice need amongst our population. They have helped to address a total of 388 distinct advice needs during this time. The main advice areas, as you might expect, are around finances and housing. But they have also supported people with issues around hate crime, safeguarding, legal issues, transport, utilities providers, all sorts, the whole range of the Citizens Advice services. The most impressive outcome for me is that in the first 12 months of the pilot, their advice created a total of £115,000 of financial benefit for these people. Now, nearly £88,000 of that is maximising income. So that's getting people onto appropriate benefits or the right level of benefit, removing inappropriate sanctions, that sort of thing. Then this means that they're more financially stable and secure and better placed to lead a settled life once discharged. The remainder, around £27,000, is debt or expenditure reduction. Now, we also work more closely with our colleagues in the Department of Work and Pensions and have local job centre colleagues delivering drop-in sessions for our service users too. Their work focuses around getting people ready for or into work, but they're also able to prevent unnecessary and inappropriate benefit sanctions, which make it more difficult for people to return home. Thanks, Sharon. Next slide, please. Both of these interventions result in us being able to discharge people more quickly and in a more sustainable way. The trusted relationships service users have built with citizens' advice or job centre colleagues create a feeling of hopefulness that life can be different and better after this admission. These support offers continue in the community, providing consistency and continuity for people as they transition out of hospital. People who are more settled are much less likely to end up in a situation where they need to repeatedly access emergency healthcare or temporary accommodation. We've got a research project underway with an external health economics organisation who are evaluating the impact of our partnership with Citizens Advice. They're looking at both the social impact on the individuals who have access to service, as well as the economic or commercial aspects of the solution. And we're really looking forward to seeing the outputs of that project. I think it's been really exciting to see that. Thanks, Sharon. Next slide, please. Okay, so this is my last stint, folks, bear with me. So next, we're going to look at a specific model that we've implemented in partnership with ABRI and the Society of St James. So I'm really pleased to say I've got a couple of colleagues joining me for this session. So we've got Jane from ABRI and Simon from SSJ, and they'll introduce themselves as we go through the presentation. And most importantly, we have a service user perspective via a video clip later on, so hang around for that. Thanks, Sharon. Next slide, please. Thank you. So getting on for about 4 years ago, I suppose, we recognised that there was an increasing demand on our inpatient rehabilitation services. Part of the demand challenge was because many of our service users didn't have an appropriate discharge option. This lack of provision or choice meant some people ended up further away from home than they should have, or we were simply creating demand elsewhere in the system. For many people, lack of suitable housing options was the most significant factor in their delay. Many of the people we were supporting did not meet the threshold for accessing supported accommodation, nor did they really need that level of support. At the same time, the local authority's housing waiting list was growing exponentially, making it difficult to access in a hurry. The work completed as part of a service user's rehabilitation identified that a safe and secure home would give the individual a dependable base from which they would be able to continue their recovery. And importantly, from a trust perspective, it allowed us to accelerate discharge, therefore creating additional capacity within the system as we increased the flow of the rehab unit. Next slide, please, Sharon. So through the creation of this solution, there are a couple of key principles embedded throughout it. Firstly, it's person-centered through the discharge planning process. So we don't hold the keys for empty properties that we hastily place people into in the hope that it works out okay. Instead, we understand what bus route the individual would like to live on, where their support network is, and whether they need ground or top floor accommodation, for instance. A home that meets the spec or requirements is then found for the individual. All of the homes are self-contained flats located across a community. Having their own front door is a fundamental. As I said, the work is managed as part of the discharge planning, so we start that process early to give our partners the best chance of finding an appropriate home. We invest a great deal of time and effort in this process early in the admission and ensure that the transition work to their new home forms a significant part of the plan. And secondly, the solution needed to be part of the system. Having something standalone or separate from the rest of the housing provision within the city would cause further delays or issues. We were rightfully challenged about this provision simply creating a loophole that allowed people to queue jump. But we were clear that this was never to be a shortcut to housing, hence part of the reason why we chose not to have homes immediately available, avoiding the Friday afternoon discharge pressures. Creating our bespoke solution allows people to stay within the footprint of their local system, reducing the impact and minimising the change they need to manage during a turbulent time in their life. And that despite the lead times for properties, the discharges are more sustainable. Naturally, in the spirit of partnership, there are benefits and challenges for all parties, and you'll hear more about those through the rest of the presentation. From a health perspective, though, We're reassured that we know we have a supportive landlord providing high quality homes for our service users, coupled with a housing management provider who can provide additional support to help people succeed in their tenancy. Now, the solution was not commissioned by the local authority or social care, although they are supportive of it, of course. Simone will talk more about the finances shortly, but I wanted to make it clear from the outset that this is a solution we've created through partnership, not something commissioned by the system. So I'm going to hand over to Jane from Adbury now. Jane, over to you. Thank you.
Thank you. So I'm Jane Ellis from Adbury, the Contracts and Compliance Specialist. And I'm just going to go through a couple of slides explaining sort of like Adbury's involvement and how we sort of became involved, and why that was really. Adbury were keen to create thriving communities and to support the NHS into creating homes for people who may otherwise have continued in that revolving door of homelessness, giving them a secure home, support and the opportunity to belong to a community. Adbury were quite keen to build on the government encouragement to build closer relationships between health services and housing to path the way to resolve some of the wider issues. This has proactively and positively cemented partnerships with trusted providers that we're currently working alongside. This was and continues to be in line with our aims of supporting the wider homelessness agenda and forming partnerships to support the NHS. I could have the next slide, Sharon, please. So to put a bit of context on how it started, in February 2019, our board agreed that the proposal for mental health recovery pathways in partnership with Southern Health Foundation Trust, and for us to contribute to a rolling portfolio of up to 15 dispersed one-bed flats. Adbury's board had an appetite to proactively work with Southern Health to support the homelessness agenda and build on relationships, and in turn bridging that gap between health and housing. Adbury explored extending the project to other local authority areas within Hampshire, but this has not proved possible as yet, as we do not have the same allocations headroom. In other areas, all nominations to our properties come via the local authority home choice-based letting system. There's difference in other areas with headroom and how the nomination rights are allocated. How it stands is that Adbury had a historical nomination agreement with the local authority, so have the headroom for this pathway to allocate some of our properties out for the pathway. Next slide, please, Sharon. So why is it important? One of the key reasons this project has been such a success is because these people have been able to become embedded in the community in which they have been housed and have been able to return to the local support networks. The dispersed accommodation model supports the community approach because rather than all being housed in one block together, people are surrounded by the wider community. And in fact, there is also a community cafe which Adbury runs within the area, which can be additional support as well. The beneficiaries of this partnership are individuals recovering from a period of mental ill health and associated hospitalisation. People who are disadvantaged within the housing market and without this scheme would spend longer within an institutionalised care setting without the opportunity to pursue independent lives. From a landlord perspective, the scheme is financially viable as we work with a trusted specialist housing management provider under a lease agreement in which they undertake the day-to-day repairs and we provide the planned maintenance. The contractual relationship with SSJ is via a 7-year lease, and SSJ is the landlord to the customer and resident. The lease stipulates vacant possession at the end of the 7 years. However, we have said that as long as they no longer need specialist housing management and there isn't any ASB housing management issues, that resident could remain and become Adbury's customer. Sharon, I think I pass over to Simone.
Hello everyone, I'm Simone Bleed, I'm the Housing Services Manager for Society of St James, and a couple of my teams, the Housing Management and Operational Security team, are involved in this project. The housing management team here are very fortunate when compared to some of the larger housing providers and local authorities, in that they have around 50 cases each per worker, rather than what can go into the hundreds. And we can provide 24/7 staff contact through the use of our operational security team that operates out of hours, covering weekends and bank holidays. This project for us is funded through housing benefit. There is no other funding coming in for this. It is exempt accommodation, and that means that we're receiving the rent directly. An element perhaps that's less of concern for the tenant in order to be able to sustain their accommodation. And we will provide support for tenancy sustainment, for example, if there's power cuts, lockouts, maintenance issues and neighbour disputes. And because we have done quite a lot of work with clients with mental health in the homelessness pathway, we, for example, were able to identify somebody who was experiencing a deterioration in their mental health in the midst of talking to them about a neighbour dispute. And therefore we could highlight to mental health services our concerns, and this engaged the individual back in with the mental health services, and they were therefore able to maintain their accommodation, and the incident didn't become, a big deal. So next slide, please. What we've learned over the past few years is obviously staff move around, and as you've seen, we've had 9 out of 15 flats so far. These are not flats that are becoming available every couple of months or something. It's as we can process, and that might mean that within the rehabs that we're working with, there's been a change of staff, and they might not even know of our service. So we have to ensure that we maintain contact and sort of effectively reintroduce ourselves. And we also need to keep that contact going, because at the point where support for the individual changes from rehab to the community mental health team, the community mental health team may not know of our involvement and our relationship with that client. And so, it's really important that we maintain those links and ensure that that's known. We had an example where there was a move on, and we weren't necessarily told that was going to be happening. And obviously there's a cost impact across the line. So, we just need to ensure that we maintain those communications and that doesn't get lost. Like I say, housing benefit is the funding for this. Our day-to-day costs are covered, but anything else that is an issue in this particular project ends up in a loss for our organisation. And at the point where a flat becomes available, it has been a little bit of a lucky situation that we have found that there is an appropriate individual within rehab services who is potentially ready or can be supported to be ready to take on a tenancy at that point. So we haven't had any flats sitting there empty, and yeah, that's been a very positive outcome. Next slide, please. What I'm very pleased to say is that throughout this, we have had no evictions. We haven't had to issue any warnings, and we have had no readmissions to hospital. So, we're also told that actually this partnership working has accelerated discharge by 3 months, because there is somewhere for people to go that is suitable, appropriate, and will support them ongoing. And we're obviously very happy to be part of this as a partnership project. It's been very positive and really nice to be part of. So thank you. Back to you, Joe.
Thank you. Back to me again. Just a little add-on on the end. We have recently started an employment service within Albury, and this has been offered out to these customers that have gone out into the flats, as well as in hospital service prior to them leaving. So the aim of it is to work to link the customer subleasing from Society of St James with our bespoke employment support offer. To support the customer's transition from NHS services into our community, and support them into a mix of, possible employment, volunteering or training, and just trying to, all aspects of reaching their full potential and support their mental health recovery. Next slide, please, Sharon. Thank you. So yeah, the employment service offers a wide range of sort of prep for the person, CV writing, trying to build with self-confidence and self-esteem. So it's just the slide highlights a few of those what we offer. And then just onto my last slide, Sharon, please. Thank you. So yeah, just in summary, very briefly, it's a customer focused service, tailored service to meet the needs of the customer group. We've got an employment coach in-house on the ward, so that service can be picked up before discharge with them, so it can be a through-ward journey and then continuing in the community. Again, yeah, optional levels of engagement depending on where that person is and what they want to take from the service. Currently open for referrals. And again, this just sort of like it's good practice and continue to develop our relationship with the partnership, working from that initial point of contact with anybody, potentially entering the pathway of accepting one of the flats down the line. I think that generally sums up our presentation for today, but we're just going to leave you with a short clip in which Hayden and his family, who have been through the process, share their experience of the journey with you. Thank you, Sharon.
Expensive whiskies, wow.
Yeah.
Okay, drunk in 2023 maybe.
Perhaps.
It's 6:22.
Now, millions of people are affected by mental health problems every single day. Now there is a warning that cost of living stresses are pushing more people into crisis.
35 charities, medical bodies and research organisations say there is an urgent need now for a long-term plan to tackle this issue, and there needs to be more early intervention. Here's our social affairs editor, Alison Holt.
27-year-old Hayden is getting his life back on track after years when he found the pressures of daily life too difficult. He started struggling with his mental health aged 15 when stressed by exams. It led to a decade of moving in and out of hospitals.
You're used to seeing the same things every day, and then once you leave the units and you're going out into the real world, it's like, whoa, what's going on, sort of thing.
Today's report says daily stresses like finding housing, paying bills and cost of living pressures are tipping too many people into mental health crises.
Hi Hayden, nice to meet you.
Nice to meet you too.
Shoes off or on in here?
Off, please.
But the flat that Hayden is proudly showing me around has been organised by his mental health trust to try to head off the problems that might push him back to hospital.
Bathroom's on the left.
Okay.
And we'll be sitting in the lounge if that's right.
He can stay here as long as he wants. He also has support available if needed.
Very, very tidy and sorted.
I can't stress enough, it's of the greatest support that I could ever have. Like it just provides that platform for you to push on and become independent, become strong-minded, and it just boosts you, gives you that boost to do what you want to do.
His mental health trust also has schemes helping with debt and rough sleeping, aimed at preventing people reaching a crisis. It says it is keeping people out of hospital.
What's really important is what's going on in that person's life. If we can treat the person, which takes into account, their social stresses, their accommodation status, their relationship status, all of these things, we often get much better outcomes.
It's preventative action that the 35 organisations calling for a long-term mental health strategy say is vital. In England, they point to a 26% rise in people needing mental health support over 4 years. And in the last year, services have seen 4.8 million requests for help. The report says, as well as improving those services, it's essential to tackle poverty and other inequalities.
If we do nothing, we will create more illness, more pressure on mental health services, more families will struggle, more people will have their lives affected by something which could be prevented. This is really good value for public money.
Hayden's parents, Pat and Simon, believe early support services available whenever needed would have made a huge difference when he was first struggling.
If we won the lottery,
we had money,
we'd put money in and make sure there was that out of hours, so there could be people that could actually come out.
So I think if we had the help and support out there, I don't think it would have been as many years as it took.
And seeing Hayden now settled and in a job has been a huge relief.
I've got my son, and I didn't lose him, basically. But we could have been looking the other way.
He's living his life now. He's doing the things he wants to do. It's just brilliant, and you can see the difference in him from what he was before. Yeah, we'll go roughly around the same time.
The government says it is moving further and faster to improve mental health services, investing more money and drawing up a strategy for the future. Alison Holt, BBC News.
And of course, keen to hear your stories and connections with
Thank you. Sorry, I was struggling to come off mute there. Absolutely fantastic presentation. So well done. Yeah, I mean, there's so much to talk about, and we're going to go to some questions and answers, but just some observations really on what we've heard. I think, that really targeting the interventions, those person-centered care across all of the initiatives we've heard today is really putting that impact where it's most needed, and having much more positive outcomes and saving people's lives. Yeah, we've heard that throughout a number of the presentations about the impact that that's had. There is something about the complexity and the number of partners that need to be involved to make this a success, and how you work together. And we heard about the importance of sustaining those relationships and really making sure that those partnerships continue to work well. So the energy that goes into that, is really phenomenal. So well done to all of those involved, and the impact that it's had both on an individual level, but also within the system. We can see that doing the right thing results in a much more positive outcome for the person, but also, it's saving money, it's creating the efficiencies within the system, it's reducing the length of stay. So it's absolutely, there's 101 reasons why it's the right thing to do. So I'm going to introduce Patrick. Well, Pat's been introduced at the beginning, but Patrick's going to help me steer us through some question and answer sessions. So that's Patrick Fowler from the Keeping Well Collaborative. So, Pat, have we had any questions in the chat?
Not questions as such, but I know there's been some kind of observations and some links shared and some feedback. I guess I was just thinking, knowing different colleagues on the call, and sorry I haven't prepared you for this, so it's a bit on the spot really. Just wondering if there are colleagues on the call that wanted to share about some really successful collaboration they've been involved in. I know Gainer's on the call from Reconnect, Andy in terms of the co-occurring conditions, and Craig from the fire service. Just wondering, kind of in terms of the mental health side and the collaboration, how important it's been to you and the benefits it's brought for obviously the people you're working for, but also yourself and organisations. So Andy, did you want to come in?
Yeah, I just want to say, I think, obviously some really good work there, and another partnership that I'd like to sort of flag up really is the one that Southern has with Sanctuary in terms of the crisis house in Winchester, which has been really successful in terms of preventing that hospital admission in the first place. But I suppose just to flag up really, yeah, there's some really great partnership working with Southern around co-occurring conditions, because people don't live in a vacuum, do they? People have mental health problems and associated needs with, that we're working much better on, I think, as a collaborative. But I suppose the thought really for me is we're at a time when local authorities are in real trouble, and we've got local authorities on the verge of bankruptcy. And traditionally, a lot of the work that they used to do was around supported housing, and a lot of that has been stripped away. So it's kind of, I guess there's a space where the NHS can potentially step into more. We can get the housing. The housing's not an issue, generally speaking, in terms of supported housing. It's the support, and some of it can be paid for through through housing benefit. But I think there's probably an untapped resource really that we can support those people in a more substantive way. And I'd like to have broader conversations about how we can do that in the future, because I know we're probably going to get another government, and hopefully they'll take a different approach to supported housing. But we've seen it, really hit hard over recent years. That wasn't a question, more of a statement, but yeah, thank you.
Thanks, Andy. I mean, definitely something that we should and could explore further. So really helpful. Sorry, Sharon, were you wanting to come in there? Is it Pat? I thought I heard somebody try and come in.
I think we've got Laura wanted to come in.
Yeah, hi everybody. Sorry I was late. Busy as per usual, but that's no excuse. We obviously work very, very closely. Everybody, I'm from Sexual Health Services Solent. I know I work with Jen from the university and with some others here also. And I know it's really important that we move forward with that, especially with the Project Fusion, where Solent is going to be joining forces with Southern Health as well. So I'm anticipating some great work's going to come from that, with even more joined up working. So, I really do celebrate that moving forward from April onwards. So we're really, really keen to push forward with all of this great work, because we know that sexual health does play an important part around mental health, be that positive or negative. And it's knowing those referral pathways in, when anybody needs those services, so we can get them quickly, seen quickly, instead of things starting to unravel very, very quickly. So I think, again, it's sort of about me just keep flagging up what we're doing, how we're doing it, and how we can make that very accessible for people as well. That was just my bit, really. Thank you.
Thank you.
That's great, Laura. And I know you've spoken previously at the Homelessness and Health Inclusion Forum, making more people aware of the services that Solent offer around sexual health. I guess, it's just helping you get those messages out there in terms of how to access those services and how organisations can come alongside you as well. Great, thanks. I think Rebecca's next, and then Craig.
Hi there, I'm Becky. I support the No Wrong Door Co-occurring Conditions team for Hampshire. So I'm really pleased to be on the call. It's really nice to hear some of the initiatives that you've got going on, and we've been doing training workshops across our patch. And what we're kind of seeing is there's some pockets of great work, and from what you've said today, the initiatives, how you've kind of got that embedded into practice. We're sort of emulated as a service, but I'm just wondering, John, and all your colleagues, kind of how are we making this now like a system approach? Because I just recognise across the patch we've got some real challenges, and I dare say, I have to say, some resistance about kind of using these models. How do we approach it as a collaborative? How do we kind of take this forward in terms of making this sort of equitable across our areas? Any ideas and thoughts?
Yeah, brilliant. Thanks, Becky. Nice to see you. So I guess for the first two that we talked about, the joint roles, the embedded clinicians and the citizens advice piece, we've got a couple of research projects underway which will help us to build that solid evidence base. So the joint roles are primarily funded through rough sleeper initiative funding that goes through to the local authorities. So in the current tranche of those roles, we're kind of reliant on the local authorities showing an interest and expressing an appetite and to secure that funding and direct it towards those roles. However, the research, I'm hoping, will kind of give us an ability to go and have a robust conversation with local authorities and Southern Health / the new organisations board to say, look, folks, this is the outcomes of us working in partnership in these areas. This is what it's achieving. This is why it's beneficial, so that we can then have that sort of fairly robust and grown up conversation about how do we do things differently in the future, and therefore not necessarily be reliant upon that grant funding from central government. So that research project is underway and is being undertaken by Southern Health's research team at the moment in conjunction with New Forest District Council. So it'd be really interesting to see what comes out of that. The second research project is the one I briefly mentioned through the slides, where we've got this external health economics organisation that are evaluating the citizens' advice work. So again, really interesting to see what the outcomes of that will be. We, as a trust, have expanded that, or across our adult mental health inpatient estate. So that we've continued it in Winchester, where we've piloted it and expanding it across the other 3 sites, and that should be implemented from early January onwards. The citizens' advice offices are recruiting to those roles at the moment. But again, it's grant funded. It's relatively short term, and we need to prove that there is a value in that. There is return on investment. So again, we can have that conversation either as a system, as a trust, or as a sort of a partnership group about recurrent funding to do more of that and expand it elsewhere. So at the moment, Becky, I guess to answer your question, it's about creating that evidence base so that we can go and have those conversations with senior colleagues to say, this is the impact, it's fantastic, it's saving lives, it's saving money, whatever the kind of the outcomes are. How do we carry on doing this in a much more sustainable way, and how do we do more of it?
Oh, thank you.
I think, Craig, you wanted to come in.
Yes, so thanks to all the speakers this afternoon. Some observations, also some kind of the point that one of the speakers made around people being part of their community. So it's all very well finding housing, but that housing is only going to work if that person, for their mental health needs, is part of that community. So I guess that's one consideration I've got in terms of how we look at those opportunities. I mean, if we've got any volunteering opportunities in that community, or even any employment opportunities for the right person in those communities in terms of some of our on-call stations. And then the second point I was to make is it's really hard sometimes to see the fire services role in this. It's very health-based in terms of space. But what we've managed to do, and I'll put a copy in the chat, is into our planning process. We've definitely built in poor mental health, because there is a link between mental health and fires. And severity of fires as well. And then the final point within that is, obviously we work with social housing providers already in terms of offering home safety visits, so making sure people are safe at home. So maybe building that into our processes in terms of making sure that we get that referral. And it's part of the support for someone moving into a new house, is how to be safe in their own home, and bring that in, because actually that could be a good start in that new property.
Thanks for that, Craig. And I know kind of you've been on this journey with us for a while now in terms of kind of the importance of home and the safety within home. How would it be best to involve you and your fire service colleagues in these conversations if colleagues on the call aren't already in touch with you?
So I think the housing teams have already got a place at the fire safety development group within that. And then sitting underneath the integrated care system now is a fire portfolio group. Forgive me, I can't remember the lady that chairs that group. And it may be that actually that's a good place for us to have those discussions more broadly, because obviously they're supporting the aims of the ICP and the ICS anyway underneath the strategy. And it might just be a place for colleagues to go in terms of, so it doesn't become just someone contacting someone within the service. It becomes part of that strategy going forward.
Brilliant. Thanks for that, Craig. Thank you. Just really inviting other colleagues on the call to share any examples of collaboration and any kind of unexpected benefits that came from that work. Just thinking maybe Gaynor on the call from Reconnecting, because obviously you're working across a range of statutory and voluntary organisations and working with the prison as well. Just wondering if there's anything you want to share.
I think just what we just are trying to collaborate with anybody and everybody that we have contact details for, really. Obviously we're covering the whole of Hampshire, and people being released from HMP Winchester, as well as coming back into Hampshire from other prisons, and often they have an accommodation need, and we may not know about where they're going until the day of their release. See, prisons are moving towards not having Friday releases, which is a brilliant move, because releasing somebody on a Friday, potentially over a bank holiday weekend, is just a recipe for disaster from any health gains that they've achieved in prison for their mental health or their physical health, if they're not released with the medication they need or anywhere safe to store it. So yeah, I mean, we're linking in with probation as much as we can, with resettlement teams. Obviously, our colleague Angie Wiseman's trying to get the resettlement board set up at Winchester, as she has done at Bullingdon, and I think that will be a real advantage as well, to have that, so that we're identifying those people sooner in the process, so that we can start looking at what applications need to be done, thinking about where their local connections are, has the duty to refer being done, all of those things that can help just expedite some of these processes, rather than here's a Friday afternoon, what are we going to do? But yeah, I think we're building up some really good networks with our community probation colleagues, and yeah, I think it's always going to be a work in progress, because I think we all recognise that resources are just often not there. But yeah, definitely been more successful in getting people accommodated, and just raising that awareness when we're having the resettlement conversations, maybe at Bullingdon, that this person's coming back to Hampshire, what can we be doing in the time that we've got? So yeah, it's definitely a work in progress, but it feels like we're making some really good steps forward.
That's brilliant. Thanks, Glenn. I just wondered, from a mental health perspective, is there a specific ask around mental health? Because obviously you deal with mental and physical health needs and continuity of care. Is there an ask from you around mental health?
I think the difficulty is always just waiting lists, that we often can't make those mental health referrals prior to people leaving prison, because we don't know where they're going, so we can't register them with a GP. So the CMHT will not accept a referral, often without either an address, or at least saying on release they will be going to this address. So again, I think just sometimes it makes the process a little bit sticky and a little bit slow. But at least if they are engaging with us whilst Reconnect aren't an interventions-based service, we can do enough. We've got enough experience within, the cohort of colleagues I've got to try and offer a bit of stability, and at least make sure that they're taking their medication while we're doing that. And I think, but again, the more that we're working with people sooner, hopefully then we can identify the GP surgery and a location, and try and have those conversations a little bit earlier. But yeah, I think the offers are always there. I think we've made some good referrals into IAP services and secondary services, and supported people to attend assessments and onwardly engage with those things. So it's gone well when we've used it. Again, it's just not always timely, just because of the situations that people find themselves in.
Great. Thanks for that, Glenn. Really helpful comment, you and your insight, and thank Andy for your comment in terms of the primary care provision. Is there anything else you wanted to come in on that, Andy, in terms of how we could utilise that provision better?
I guess it's it takes time, doesn't it, for people to learn about what, and to be fair, a lot of the recruitment is still ongoing, and there's been some challenges around that, but there is much more provision in primary care through the No Wrong Door initiative to provide support to people that could potentially be more responsive, I guess, in terms of more immediate referrals and sort of triage. So we probably as a system need to promote that more, I think, with our partners. But it's an ongoing process, I think, of promoting those services.
Thanks, Andy, and thanks for highlighting that. And I think, unless there's any other burning questions or points, I think we're just about there. So I'll hand back to you, Heather.
Thank you, and brilliant discussion. So thank you all for contributing. Really thank you to all of our speakers today. We've heard some fantastic examples which have really made a difference in people's lives, and these have not been easy projects to deliver. You've worked tirelessly to make sure you are making that impact, so creating solutions for people that didn't previously exist and creating new options for people who would otherwise have been perhaps stuck within services. And at the heart of that has been treating the person rather than the diagnosis, to address the underlying reasons why people are getting into cycles of need. So brilliant piece of work. Thank you. Sharon would just like me to make sure that I give you a little bit of a a plug for the future dates. So as we said at the beginning, this is part of a mini series for sort of lunch and learn podcasts. So I think there's just 2 more left in the series. Is that right, Sharon? So we've got avoidable hospital admissions on the 24th of January. And I think that one's been hosted by Hampshire Hospitals. And then minding every gap, so reducing reoffending through homelessness prevention, on the 7th of March. So hopefully those will resonate with some of you on the call, and you'll be able to join those. So again, thank you to all of our speakers, but also particular thanks to Sharon and Pat, who've worked really hard behind the scenes to pull this together and to make sure we've had some thoughtful discussions today. There's an immense amount of effort goes into planning these, so particular thanks go to you for organising that, and thank you all for joining us, because it wouldn't be an event without everybody joining and being part of that collaborative conversation. So hopefully we'll see everybody in January for some further discussion. But platform from today to, I'm sure there's going to be lots of further and ongoing conversations on the back of what we've talked about today. So please do take that opportunity to connect with colleagues across this conversation and beyond. So thank you all. Take care.
Thanks, Heather. Thanks, everyone.
Thanks, everybody.
Thank you, everyone. Thanks.
Take care.
Bye-bye.
Bye.
Thank you.